Wanted to start off by talking about the epidemiology and some facts about Streptococcus pyogenes. To start, Streptococcus pyogenes is associated to various serious diseases that have high morbidity and mortality rates. One of the most common signs of S. pyogenes is pharyngitis, or the inflammation of the throat, and the prevalence of S. pyogenes infections have increased over the last 2 decades, and this is most likely due to changes in virulence and or resistance to antibiotics. Prevalence is much higher in younger children, like toddlers and whatnot, and infections vary from underdeveloped and developed countries, and most low-income areas suffer more so from the burden of S. pyogenes. S. pyogenes infections cause acute rheumatic fever, which can manifest into rheumatic heart disease. And this is a pretty rare case, but it mostly happens in low-income areas. So S. pyogenes is a Lancefield group A streptococcus, and it's a gram-positive streptococci, and it usually is found in the chain-like arrangements that you see in this photo, and it is found in humans in the nasopharynx and mucous membranes. So, about the morphology and the features, it is a gram-positive spherical cocci, and it's found in chains, like mentioned before, and it's usually about 2 microliters in length. It is catalase negative, it's non-motile, non-sporing. It is also beta hemolytic and bacitracin sensitive, and meaning it cannot survive in the presence of bacitracin. Now moving on to the virulence factors, the M protein in the S. pyogenes, it inhibits C3b opsonization that can remove bacterial pathogens. The function of opsonization is where a bacterial pathogen gets tagged with the C3b, and then specialized macrophages in the spleen see this C3b, and they know that they have to remove it or basically kill it. The M protein in Streptococcus pyogenes, it inhibits this function. Hyaluronic acid capsules also inhibits phagocytosis, and the capsule actually protects it from macrophages to begin with. So we can see the M protein in this capsule kind of have the same end goal that gets inhibited. Moving on to the mechanism of infection, the protein F promotes epithelial cell attachment, including those of the nasal and oral cavities, and the protein F, or fibronectin binding protein, it helps essentially the strep pyogenes get into the epithelial cells. So this is an overview of the diseases, and I'm going to go into more so of these later on. You can take a look at both of these photos, as I will mention them later on in the next slides. Alright, so the first disease is pharyngitis, which is probably the most common disease that we see correlated to strep pyogenes, and it is an inflammation of the throat, and usually there's a fever correlated with it. And it was that first photo that we saw in the slide prior, where it's like kind of white patches on the throat. And it's usually seen in younger children and younger toddlers, and it is also known that strep throat is caused by group A streptococcus. Next is impetigo, and you can see this in the photo above, and it's not pretty to look at. It's non-bolus, like yellow coloring crusts with kind of redness around the skin, and it's usually found around the mouth or on the extremities, so it's definitely not nice to see, but yeah. Next, we see this disease, this post-streptococcal glomerulonephritis. It's a hard one to say. It usually follows pharyngitis, and it's usually, since we see the name, the nephritis in there, that's a kidney problem in there. So it usually shows hematuria, hypertension, and edema, and those are all kind of signs that there's a kidney infection going on. Rheumatic fever, it can occur about 2 weeks to a month after a strep pyogenes infection. It causes pancarditis, meaning the inflammation of all the layers of the heart. And it also causes irregular movements of the head or neck, kind of spasms. It's called Sydenham-Chorea because there's this cross-reactivity in the immune response against the basal ganglia, which is in your brain, and it controls your movements. And then moving on is the erythema marginatum. It's the red rashes that we saw in the first slide. It's kind of all over the body. It's usually in the trunk or proximal parts or limbs. Next is subcutaneous nodules, and we see that right above in those kind of nodules on the hands. It's definitely not nice to look at. It's the growth of lesions deep in the skin, usually easier to kind of feel than to see sometimes. Other times are not as this pronounced as in this photo. And these are also highly related to the rheumatic fever. Is scarlet fever, and this is correlated usually with the swelling of pharyngitis in the throat and with fever, as it's in the name. Strawberry red tongue, which we see in the photo up above, and sometimes there is white around the tongue with pretty much flushing of the face, so super red, kind of rashy, and it's a sandpaper rash like kind of all over the body, as we see in this child up above as well. Erysipelas, it's raised inflamed patches and or plaques on the upper dermis or in the lymphatic area. So we see this on the patient's nose right here. And then there's another disease, necrotizing fasciitis. So this is rare, and it is usually found in the lower income, kind of poor infrastructure areas. And it is an acute, rapidly progressive, deep-seated infection of the subcutaneous tissue, and it causes destruction of both that superficial and deep fascia, and usually seek medical attention as soon as possible. It's definitely disgusting. It probably stinks. And you have to get it basically removed off your body. So I can imagine the care is not pleasant. Before, there's a ton of diseases that can come out of this. So the signs and symptoms are very vast, and the diseases that it causes is vast. But usually there is acute pharyngitis, so you see that swelling in the throat. There's a cough, rhinorrhea, or basically a runny nose. So it's that nasal discharge or mucus coming from your nose as well. We also see hoarseness in the voice, especially due to that swelling in the throat, and the oral ulcers as well. It's also known as strep throat because we know that Group A Streptococcus causes strep throat. Other symptoms can be the diseases aforementioned, but definitely seek medical attention before any of the symptoms worsen, especially because we don't want to see patients going in with the scarlet fever, so best to seek medical attention. So seek medical attention as fast as possible. Transmission of S. pyogenes is through droplets from a sneeze or a cough by someone who is infected, or you can get it by sharing food or drinks with someone who's infected, by contact of wounds or sores on the skin, and infection is most likely when a person is actively sick with symptoms and transmitted bacteria, meaning it is most likely to happen if that person is actively showing those symptoms to pass it on to someone else. A lot of ways that we can kind of diagnose this S. pyogenes. There's swab cultures, like throat swabs or the cultures. It can be taken to look at the morphology of the bacteria through gram staining. PYR testing, or pyrrolidonyl aminopeptidase. It's a test that looks for the activity of the pyrrolidonyl aminopeptidase in the Streptococcus Pyogenes and to differentiate between other beta hemolytic streptococci. Since S. pyogenes is unable to survive in the presence of bacitracin, you can also test for the bacitracin susceptibility, as the S. pyogenes can be differentiated from other non-group A beta hemolytic streptococci by their increased sensitivity to the bacitracin. After incubation overnight, if there is a zone of inhibition, this indicates a susceptibility of the strain. And you can see that kind of in the plate over there. It's usually used with a SBA medium, and you can see that kind of circle or the zone of inhibition there. It's also important to note that since other beta hemolytic strains of streptococci may contain the group A antigen are resistant to bacitracin, the bacitracin test along with the Lancefield antigen test or antigen A test is used for greater specificity in the identification of the S. pyogenes. First line of treatment that doctors usually go for is penicillin. If the patient is allergic to penicillin, there's also macrolides, so that's our azithromycin, erythromycin, clarithromycin, or roxithromycin, or other ones. So if the patient is allergic to that, there's other antibiotics that the doctor will prescribe. Clindamycin is also used for more serious infections. And if necrotic tissue is involved, so like that's the necrotizing fasciitis, usually intravenous antibiotic therapy and surgery are recommended to remove the infected skin. Prevention of really anything, it comes with good hygiene. So wash your hands often, soap and water for about 20 seconds, cover your mouth by your elbow or use a tissue when you're sneezing or coughing, and do not share personal eating utensils or water bottles. And especially when you know someone's sick, you shouldn't share anything with them. And of course, nowadays, wear a mask if you're sick. There is no long-term immunity to S. pyogenes, and there is no vaccine for the Streptococcus pyogenes. There is, however, an ongoing search for the vaccine, and considering it is a very common infection, this is kind of surprising that we don't have a vaccine, but of course they are definitely looking into making one. It's just since strep pyogenes causes such complex infections and diseases, it's hard to it's hard to see if a vaccine will be coming out anytime soon. It's also important to also say that a major economic impediment is the fact that 95% of all serious S. pyogenes diseases occur in low and middle income countries or underdeveloped countries too.